Díomh agus fáilte rih bailíoch lia. Tá brónarm nach bhfuil mé ann a bheith libh ar an láthair. Hello and welcome to Dublin. I'm honoured to speak at the 35th International Epilepsy Congress today, and I'm sorry I can't be with you in person. With over 3,000 professionals in epilepsy care from all over Europe and beyond attending, you're all very welcome to the biggest international meeting of its kind this year. While we work across different countries, in different environments and different health systems, we all share our common humanity, ambition and values. It's at events like this, where we can all come together, share experiences, collaborate, discuss issues and learn from each other, that we'll be able to transform our health services for the benefit of us all. I'm especially pleased to see how this year, for the first time, the Congress will include a special public programme to be held over 2 evenings. Organised by Epilepsy Ireland, these are fantastic opportunities to have global experts interact with patients and their families. With about 40,000 people living with epilepsy in Ireland and about 2,000 people diagnosed each year, I'm particularly heartened to see this programme included this year. I hope that those who attend find it to be a worthwhile experience. In Ireland, we've made great advances over the past number of years in treating people with epilepsy. The commitments underpinning our National Clinical Programme for Neurology reflect those of Sláintecare, the government's plan to bring about universal healthcare in Ireland. Healthcare that is integrated, affordable and accessible for all, with good patient outcomes. This is being implemented with the support and guidance of the Department of the Taoiseach, or the Prime Minister's Office. We're also improving access, quality and value for patients with neurological conditions, including epilepsy, for all age groups. Recruiting and retaining specialist doctors, nurses, therapists and other staff is an international phenomenon, and one that affects us deeply here in Ireland. Our new consultant contract offers significant salaries to specialists willing to commit to public practice in our public hospitals, with the option of off-site private practice for additional income. We're also changing how we provide care by improving communication between primary and specialist services and developing access to information. We're promoting the management of epilepsy at primary care level in particular. Significant innovations in epilepsy services enabled by our National Clinical Programme over the years include the development of a cohort of advanced nurse practitioners to help in the chronic disease management of epilepsy and integrate it with care in the community. The development of the Epilepsy Electronic Patient Record, promoting patient safety by providing current, accurate patient information to clinicians. Improved pathways of care and transitional programmes, helping adults with epilepsy to move from paediatric services to adult services. We've also approved several innovative projects through the Sláintecare Innovation and Integration Fund, including a project by Epilepsy Ireland, offering an in-depth education session to patients shortly after their diagnosis. The project showed how a joint approach between community and hospital care can assist people living with the condition. 88% of participants reported an increase in their knowledge and understanding of their condition. Another project in St James's Hospital here in Dublin developed a new pathway for the care of homeless patients with epilepsy, a particularly vulnerable group. We're also continuing to implement our neurorehabilitation strategy and have provided funding for additional multidisciplinary teams and extra neurological nurses across centres dedicated to patients with MS, Parkinson's, Huntington's, epilepsy and neuromuscular diseases. Ireland is very much on a journey of healthcare reform. We're not there yet, but we have made significant progress. With new thinking, new perspectives, and by pooling ideas, we can and will do better. Significant advancement on epilepsy research is being made in Ireland. This is with thanks in part to the links between our National Clinical Programme for Neurology and the RCSI Genetics Group over the years. This collaboration resulted in senior participation in the ILAE Genetics Consortium, which has been making discoveries that will improve diagnosis and treatment of epilepsy into the future. Together we can and will achieve better health outcomes through excellent research, data and evidence. I know a huge amount of work has gone into organising the Congress this year, and my particular thanks to Professor Helen Cross for inviting me. As a doctor and as a politician, I know that epilepsy can be one of the most stigmatizing conditions. By learning about the latest care, treatment and research at events like this, we can improve the lives of people with epilepsy and the lives of their families too. So I'd like to thank Epilepsy Ireland, which has a long and successful track record of working with the Irish Health Service to develop and improve services and to work closely in planning the Congress here in Dublin. Thank you to all of you involved in the care of people living with epilepsy. I wish you well for your meeting here in Dublin as you learn and find inspiration from one another. Thank you very much.